Dear students, let us discuss about the mallet finger. Let us discuss a clinical case scenario to understand the anatomical basis for the mallet finger. A baseball player comes to the OPD with a history of baseball hitting the index finger while playing the baseball. The finger is bruised and swollen, and he complained inability to extend the terminal phalanx. This is the problem with which the baseball player has come to the OPD. It was observed that there is 45 degrees flexion of the distal interphalangeal joint of the finger and inability to actively extend the distal interphalangeal joint, and there is tenderness along the dorsal aspect of the finger. These are the observations of the examining doctor. After listening to the problem and the observations of the examining doctor, you should be in a position to answer what is the diagnosis and how you will define the condition, what are the causes for it, and you should be in a position to explain the anatomical knowledge required for understanding this condition and what investigation will be useful for the diagnosis. It will be diagnosed as a case of mallet finger, and the other name for the mallet finger is the baseball finger, and this can be defined as it's a case of flexion of distal phalanx due to injury to the extensor expansion which is inserted into the distal phalanx. So it's an injury to the extensor expansion of the finger. So you are seeing in this picture the tear in the extensor tendon. So that is getting inserted into the base of the terminal phalanx because of the hit by the ball on the distal phalanx. Because of that, there is a tear in the extensor tendon. It's getting inserted into the distal phalanx, and then that has resulted in the flexion at the distal interphalangeal joint. What is the cause for the condition? So there is forced flexion of the distal interphalangeal joint, and it is usually due to traumatic blow to the distal phalanx, either due to the sports as in the present case or due to manual labor. It can also result from crush injury to the distal phalanx. So when the finger is stuck in the door, this usually happens with the children. Any finger can be affected, but most common will be the middle finger, ring finger and the little finger. So it's common in younger males and older females. You can see in this picture the mallet finger. So there is a flexion at the distal interphalangeal joint of the middle finger which you are seeing. To explain the anatomical basis for this condition, you should have the knowledge of formation of extensor expansion. So what is this extensor expansion? It is triangular fibrous expansion of extensor digitorum tendon, so which divides into 4 strips for the medial 4 fingers. So this extensor digitorum for each of these 4 fingers on the dorsal aspect of proximal phalanx and metacarpophalangeal joint. It forms the expansion, and it is a triangular in shape, and it has a base that will be encircling the metacarpophalangeal joint of each of these 4 digits which you are seeing, and this is the base of it. And then this expansion is not seen extending onto the palmar aspect, so only on the dorsal and lateral aspect. So the extensor digitorum tendon for each of these digits, it will divide into an intermediate one, an intermediate strip and 2 lateral strips. So at the level of the proximal interphalangeal joint, it will divide. And the intermediate strip, you can see, observe, it's getting inserted onto the middle phalanx, whereas the lateral strips, they will join each other and again they get inserted into the dorsal surface of base of distal phalanx. And if you see, each of these lateral strips will be joined by interosseous muscles, so one on each side, and by the lumbrical muscles on the lateral side nearer to the base. And if you observe the expansion for the index finger, it will receive the additional strip of tendon of extensor indicis. Similarly, that of little finger receives the additional strip of tendon of extensor digiti minimi. And for the thumb, a similar expansion will be formed by the tendon of extensor pollicis longus. And for the thumb on its lateral side, this expansion is joined by tendon of abductor pollicis brevis, and on the medial side by the first palmar interosseous muscle. So this anatomical knowledge is required for you to give the explanation for the occurrence of the position of finger in a case of mallet finger. So through the medium of extensor expansion, the lumbricals and interossei are able to act on the interphalangeal joints. Thereby, they produce the extension movement at these joints. Hope now you have understood about the formation of extensor expansion and its function in extension at the interphalangeal joints, and you have understood about the mallet finger and what are the conditions that can cause the mallet finger and its anatomical basis. Now let us see the investigation part of the mallet finger. The X-ray is the one that can give clue about this condition. There can be either the flexion at the distal interphalangeal joint with no fracture, no bony fracture, as you are seeing in this case. So here also you can see. So there is the rupture of the tendon okay, of the extensor expansion tendon. So that has caused the distal interphalangeal flexion without any fracture, or there can be an avulsion fracture. Okay, we are seeing a fracture fragment, okay, the terminal phalanx of it, with the dorsal aspects of his base you are seeing. This is called the avulsion fracture. So that can also produce the mallet finger. So now you have understood about the extensor expansion and its clinical importance, that is the mallet finger.